Hello, today we'll talk about a condition that we frequently encounter in both athletes and physically active individuals. Meniscus injuries, and the important role physiotherapy plays in their treatment. In this video, I'll explain how non-surgical treatment works, and I'll also walk you through the phases of post-surgical rehabilitation, step by step based on scientific evidence.
1. Ever first treat. In that topics for meniscus injury.
What are the treatment options for a meniscus tear? A meniscus tear is a significant injury to the load-bearing and rotational structures of the knee. Treatment depends on the type of tear, the person's age, activity level, and individual goals. There are generally three main treatment approaches: conservative, non-surgical treatment, partial meniscectomy, removal of the torn part, meniscus repair, suturing the tear. Recent research shows that for small or degenerative tears, physiotherapy-based conservative treatment can be just as effective as surgery. This means not every meniscus tear requires surgery.
You would have then socialized longer, like in training, Stephen, with that both of this injury.
2. Conservative treatment, healing with physiotherapy. In non-surgical treatment, the main approach is a structured rehabilitation program led by a physiotherapist. When planned correctly, it can give excellent results. Days 0 to 2. Rest, ice, compression, and elevation. The goal is to reduce swelling and manage pain. Crutches may be used temporarily if needed. Days 3 to 7. Gentle knee movements begin as pain allows, flexion and extension. Isometric quad sets and straight leg raises, SLR, are introduced. Weeks 2 to 3. Pain and swelling are greatly reduced. The person returns to a normal walking pattern. Strength and balance exercises begin, like mini squats, step-ups, and single leg stance. Weeks 4 to 6. The person can now move pain-free. Low-impact cardio like cycling or swimming may be added. Muscle strength, balance, and coordination around the knee are developed. After week 6, if the person can squat and rise without pain and control knee movement during light jogging, return to sport is gradually planned. Jumping, cutting, or changing direction is only added when full knee stability is regained. Remember, success with conservative treatment depends on doing the exercises regularly and under physiotherapist supervision, including consistency at home. 3. Rehabilitation after surgery. Post-surgical rehab depends on the type of surgery performed. If meniscus repair was done, for the first 4 to 6 weeks, weight-bearing and active movement are limited. A knee brace or movement-restricting orthosis is used. Only isometric and passive movements are allowed during this time. Gradually, weight-bearing begins after week 6. If partial meniscectomy was done, the person can usually walk fully weight-bearing within 1 to 2 days. The rehab process is faster. Most people can return to sport within 3 to 4 weeks. Strength and balance training starts early. In both cases, physiotherapy is essential to ensure safe and complete recovery. 4. Return to sport criteria. Recovery timelines vary from person to person, so being ready isn't just about time, it's about functional readiness. Key criteria for returning to sport: no pain or swelling in the knee, full and symmetrical range of motion. Quadriceps strength is at least 90% of the healthy leg. Good performance in functional tests. And most importantly, the person must feel confident. 5. Long-term risks and meniscus protection. The meniscus plays a critical role in protecting cartilage and evenly distributing load in the knee. That's why preserving it, especially in younger individuals, is so important. Although meniscus repair takes longer to heal, it provides better long-term protection for the knee. On the other hand, Procedures like meniscectomy may offer quick relief, but they can increase the risk of knee osteoarthritis later in life. For this reason, the most appropriate treatment should be chosen individually and always supported by professional physiotherapy. In conclusion, meniscus injuries can be successfully managed with the right plan and evidence-based physiotherapy. Whether you're going through non-surgical rehab or recovering from surgery, physiotherapy is at the heart of this process. If you're experiencing knee issues or are in a risk group, don't wait. Seek help from a qualified expert. A conscious and consistent rehab plan will help protect your knee and keep you active for years to come.